All right, welcome everyone back to the PRESSBOX, partnership between the Society for Simulation and Healthcare, SSH, and HealthySimulation.com. We're going to be covering different discussions and interviews and presentations over the next 3 days as part of an opportunity to share more about what's happening here on the exhibit floor at the conference in general. For those of you who might not have been able to make it here, or for those that might be checking out the exhibitors, just some interviews and content here today. We've got with us Lynn Welch from Education Management Solutions, and as well we have Amar Patel from CAE Healthcare. They are coming in here to help to represent industry with regards to impacts of COVID-19 from their perspectives, what they have seen to the healthcare simulation industry. So Lynn and Amar, we just recorded a presentation about the survey results that we found from HealthySimulation.com survey. A couple of key things that I want to share with you quickly. One of the questions, remote simulation technologies we invested in to combat COVID improved learning and training outcomes over the previous ways that we train the same material. We had 40% of respondents say yes, it has improved those things. 44% said that it was about the same. So I think overall an improvement. And here's one that I think is just absolutely amazing and very, very telling with regards to leadership perspective. Institutional leadership, presidents, C-suite, deans have become more aware of our simulation programs and its capabilities because of COVID. 70% agreed or strongly agree with that statement that it made an impact and a difference. So, clearly from the community, we're seeing that people are saying that the investments that they've made in these distance and remote learning technologies or other simulation technologies to overcome COVID have made an impact, brought awareness to their program. Actually, also there was another survey question about improved performance, and about 30% said it did improve performance over the way that they did in the past. So from the academic and from the user side, I think it's made an impact. But I'm really curious to know, from your side and from the vendor side of things, what have you seen in terms of trends, differences, needs from the community, and where have been the pain points that your companies have been able to help and solve? So, Lynn, if you wouldn't mind going first and telling us a little bit about where EMS has been these past 2 years and what it's seen happen out there.
Sure, we were in a very interesting position in March of 2020. In 2019, we saw so many of our client base that was migrating towards telehealth because their students graduating go on to be practicing telehealth. So we had a telehealth workflow in our platform already. And what we had the opportunity to do was partner with our clients to really understand what does that look like when your entire program goes
now telehealth, right?
And
instead of just a percentage, but
what
everything.
do we have to add quickly, tweaking some of the workflows so that it was a more experience-rich environment, and we were fortunate we already had the telehealth baseline.
Right.
So we were able to very quickly, I remember the first month that things were shut down, our marketing team and our developers, nobody had a day off. But we were just fascinated with what we were doing because it was changing so fast.
Right.
And we were on the phone on weekends with our clients, testing workflows, pushing out new product and innovation, and then seeing it put into use immediately. And so one of the things that I've been fortunate in my career in simulation, which started on the military side in the immersive gaming world.
Right.
I spent time with a lot of the early first generation of the Microsoft Xbox that was funded by DARPA.
Okay.
And I was one of the beta testers at a government think tank I worked at. And never since that time did I have an opportunity to be immersed right in the cutting edge of innovation.
Right. And
I feel very fortunate that I've had 2 runs at that in my career because most people don't get that opportunity.
Right.
So I feel that the innovation that's happened being driven by COVID, it's an unfortunate prompter of technology leaps.
Right.
But what our industry did as a whole, I found remarkable. I know we had well over 100,000 hours now in virtual simulation that we delivered.
Wow.
I know, Amar, your company was right in there too, doing something very similar. So I think that where we are today, it would have taken us 5 to 10 years to get there.
Right.
So it's just amazing what our community can do as a whole when industry and the organizations and the society and healthy simulation. And I know I got calls from you. I was getting calls from everybody. And we were all talking, what do we do? How can we move it forward? We've got to keep students moving forward.
Right, right.
We cannot have a gap in healthcare providers coming out of schools.
Right.
So we'll still be unpacking where some of the gaps were,
right?
Because surely there are, but I just think it's amazing what we've been able to do.
Yeah. You know, what you said about the acceleration in that 10 years, you know, I really think that COVID, as unfortunate as it has been a catalyst for our industry
You bet.
in terms of global awareness about the need for education and training under dire conditions in the healthcare setting. And for those that are, you know, considering being prepared for the next pandemic, which I think every government body and every hospital and every school and, you know, local, state, and national leadership in terms of the government will make plans for this in the future, right? In terms of making sure that they're going to be better prepared for the next one. And I do think that, you know, as we see in the results, it's making an impression in terms of what simulation can do. And I think that that has lasting effects beyond COVID and beyond a pandemic. This is going to have an impact on our industry as a whole. So for you, Amar, what has CAE Healthcare seen, you know, in the past 2 years, and how did it respond to this crazy time?
So, you know, the biggest change that certainly across the industry that existed, or even across healthcare collectively, was the changes in where education and training was built. And when we think about hospital systems shifting and adjusting in real time, you saw moves from where live simulation experiences happen to in situ experiences, right?
Right.
People were doing hand hygiene trainings and PPE education, and you would think at a foundational level, that's the core of healthcare in general. We do it every day, but why are we having to retrain so many providers in real time? At the same time, the academic environment certainly shifted, right? They moved to a virtual experience almost instantaneously. Individuals had to figure out how to do curriculum and content in a virtual world.
Right.
And everybody assumed that it was just an easy pivot. 8 hours of classroom is 8 hours online. When we all know in reality, 8 hours on Zoom is a brutal, brutal thing for a learner. It's very difficult for your kids who are having to shift, and it's difficult for adults to make that change.
Yeah, I wonder how much in that, you know, with those learners, how much of it could be done virtually without all those additional extra pressures that, you know, life forced upon all of us in a lot of different ways. How did CAE find that transition for its clientele, though, in terms of once they were able to get into an online space? Was that a challenge for them, or was that something that they were able to actually quickly adopt? And the reason I'm asking is because, you know, on the technology adoption scale, we have these laggards. We have these late majority people. They're not going to get involved until they absolutely have to. And is it because they're uncomfortable, or is it because they're just resistant? So what was that transition period like in terms of CAE's perspective?
You know, for individuals, and one of the things that we certainly did is ramp up pretty hard and fast with leveraging adaptive learning education modules, enhancing the entire audiovisual systems experience to allow for better remote learning experiences, right?
Okay.
Tying multiple pieces of technology together. To Lynn's point, it's important to make sure that learners have a single system and have access in a single unified ways, right? So,
and that they have those features that they need in order to actually maximize their time, that now they're 100% here.
And enhance competency, right? So we had competency-based education in a live environment. How do you do competency in a virtual world?
Right.
How do you measure performance? And in healthcare especially, where it's skills-based evaluations, how are you measuring the performance of an individual for success, right? The question we haven't ultimately answered is, we had a lot of fourth-year nursing students or fourth-year medical students graduate in a virtual world.
Wow.
What is the impact that has? And for us, you know, we really believed in the fact of utilizing adaptive education to drive competency, effectiveness, and efficiency. Let the student create their own journey.
Yes.
Stop dictating the journey from a teacher's perspective. Let students and learners really focus on that. And to be able to do that, you know, launching online modules, mechanical ventilation was probably the biggest thing 2 years ago. Huge drive for ventilators in the field. Training was a requirement. You know, quality and safety to ensure educated people were present. So we invested pretty hard in making sure we created an adaptive ecosystem for our learners. You know, we provided scenarios in education so that those can be utilized in a virtual world.
Okay.
The big question ultimately is going to be, did it make an impact in the quality and safety metrics for individuals that were trained in a virtual world in their last year of school? And I don't think we know the answer to that question yet, right?
Right.
I think we're still learning it. We are starting to see a normalization, right? As we think about the 2-year curve, you know, where a lot of the focus across, whether it's industry collectively or us as an organization, has been as we saw in-person at a high rate, we saw virtual at a high rate, and now we're starting to see the middle start to center itself a little bit, where hybrid is really here to stay. People said hybrid would never be a sticking point. And we're seeing that normalize. We're also seeing the utilization of adaptive education, whether it's mixed reality, right? Lots of virtual, I mean, sitting here at IMSH, we're seeing a lot of organizations have virtual reality education and training.
Right.
We're certainly pushing hard and pushing fast and furious into that as well, because we believe that to be the future. You know, when I think about cost impact and knowledge retention of a learner, it isn't discussion boards. I mean, how many of us have had effective discussion boards that actually retain something? You know, and so where it is mixed, immersive simulation experiences, the physical body is never going away, and we believe that to be true, where skills-based training, competency assessments in Alive,
we still need to do that stuff.
Yeah,
but now, and this is what I've been saying on the healthysimulation.com Learn platform, on these webinars that we've been doing. It's like we've got a learning pyramid, and here's, you know, your top apex would be, you know, your high fidelity simulation lab experiences, but now we're adding this whole nother layer that really didn't exist 5 years ago of digital based learning technologies. And I really like what you said with regards to the concept of nonlinear learning, right? And so now we have the ability for learners to come in and, in a sense, choose their own adventure of how they want to go through the learning. And the thing is that some learners might be comfortable with skipping to chapter 4, starting there, doing all that work. Of course, you're still going to need to show competencies in all those other areas, so that functionality and those features are really important for educators. So to me, it seems like for both companies, it's been an opportunity to dive deep into those tools and come away with more learning about how they can be effective and utilized now and in the future. Where would you say, in your experiences, now that we seem to be coming, you know, I would say we're near the end, but who knows anymore where we're really at with Omicron, and next week it'll be Zetacron, who knows. But how have you seen, just in the past, like say 6 months, as you know, things had tapered off a little bit, we were seeing this be slowing down, are groups still really active in those digital learning technologies just as they're starting to bring back online the in-person stuff? Or are you seeing like, ooh, it's a quick switch back over, or is the digital based stuff still remaining to be an important part of that educational piece? And then we'll start with you.
So from our perspective, we're seeing the hybrid here to stay. I agree with Amar entirely.
Here to stay, okay.
Here to stay. And it gives programs a lot more flexibility. It gives students a say in guiding and directing their own learning and their pace of learning, which is very important. And the other piece we didn't touch on that I think is very important is we saw a lot of larger healthcare systems embrace this as a way to truly solve the just-in-time learning issue.
Right.
So for example, we work with a behavioral healthcare system, and they adopted to what they had planned to have live simulation centers up and running, went to complete virtual. They deployed 2 main courses that were very much focused on some of the mental health challenges that COVID's been driving, and increased risk of suicide, for example. They have 5,000 clinicians. They were trying to train on a new methodology.
Okay.
And so they were very quickly deployed a hybrid approach to that, where they had them learning the new modalities in didactic, online, and then there was a live simulation, virtual simulation component of that. And then they were immediately going into practice. And at the same time, they were a driver of having the long-term waiver for telehealth reimbursement pushed forward legislatively.
Okay.
So they were training their
leveraging
staff.
what they're doing.
They were training their staff in a hybrid environment and a fully virtual environment, and they were training them on how to practice and deliver telehealth. And one of the things they saw, all during COVID, as they started rolling these courses out and they started delivering the telehealth model, they found that their patients had a 90% improvement in outcomes. For a 10-week series of treatments, they found patients, because of the telehealth model, which was built on a similar technology backbone, they were participating. They were finishing courses of treatment, and there were better outcomes.
Wow.
So when you look at...
Maybe some of the barriers just showing up, you know what I mean?
Exactly. And if you look at where we have been historically with the adoption and trying to challenge with just-in-time training, are we ready for the next public health issue? Are we ready for the next pandemic? Do we know how to scale that training up rapidly? This was a great learning model to understand, yes, we can.
Right.
And so the advances that have been both on the education and on the delivery side will continue to accelerate us and make us better prepared for the next major event.
Right. And so, you know, I love what you said there, you know, about just that utilization seems to be continuing, and that again, that brings it back to C-suite executives and leadership seeing the success, thinking about other ways. I mean, the costs involved with brick and mortar versus being able to just have access to it, in a sense, it can democratize the process even further, more access to more content, more time. So you have learners who can, 24/7, utilize these things, and that's leading to better patient outcomes because they can do it on their own time and they don't have to go somewhere and interact with things. They're going to get better compliance. And how much is that going to save hospitals and institutions for just the cost involved with patients not completing the task that they need to do in order to get the kind of care that the group is trying to provide for. Yeah. So Amar, on your side with CAE Healthcare, same question in terms of, are we seeing any differences? Are we seeing any drop off at this point, or is it expanding? What is digital and online and remote looking like compared to, now maybe versus a year ago when it was like everyone was going bananas?
Well, as I mentioned, it is starting to normalize a little bit, but to reiterate, as Lynn has already highlighted, hybrid is here to stay, right? And one of the challenges that we're certainly running into is to what level of degree, right? Is that 3/4? Is that half? There's a great model in a chart that really talks about education and training in 2017, and then education and training in 2022, 23, 24, 2030, right? You're going to see a larger flip over to virtual training experiences.
You think more is coming?
Well, if you mirror the world of civil aviation and business aviation, which healthcare simulation does a lot of.
Right, and CAE is one of the leaders in aviation simulation, absolutely.
It's a good portion of our work, and a lot of our knowledge and experience in where healthcare simulation comes from.
They're already there.
Is already there, right? Business and commercial aviation is doing that, right? You see that in the defense forces.
Yeah.
And if you look at where those teams go, I can learn to fly a plane without ever touching a real plane.
Exactly.
So you think about the impact and value simulation has. Can we train a provider to become a provider without ever touching a real patient, right? Lots of debates, lots of negotiations, but hybrid is certainly here to stay. One of the things that we're hearing from customers across the board is there is a balance. People want to get out. People want to shake a hand. People want to have an in-person session just to learn from the hands-on tangible.
Right.
But there's a couple challenges that still exist, right? There's still a workforce shortage that we have to combat with. And there's still online training needs from a competency for Joint Commission, DHSR, and others that still meet the checkbox that healthcare still lives in.
Right.
So will we ever see a complete flip in one way or the other? I don't think so. I think you're going to see this nice, happy middle ground continue to converge.
And the clinical process is normally can be a human-to-human process. We have skills where we're going to, intubate a patient. Well, you can't really practice that skill set unless you have a mannequin and you can go ahead and do that skill set. However, the didactics for that portion, the process for that portion, the order of operations, what it looks like, all of that can be done digitally. Then we extend that and complement that to the in-person simulation experienses, right? So
today,
a blended approach.
So today I think about ultrasound training programs, right? And I think about one of our product lines, Biomedics. I can teach you how to do competency-based ultrasound, leveraging master learning that's already built into the system, and then I'm testing you without a physical instructor ever being present, right? So can we build that same ecosystem on vascular access, on IO, on airway? I mean, the list becomes endless.
Yes.
Where you don't need, if we have a workforce shortage, how do I continue to accelerate learning, which is a large portion of what we do, especially on our other business lines, for a learner that contributes to the workforce needs.
I think it's going to be remarkable to see 20 years from now, look back, how much of this was because of COVID in a sense as that catalyst. But just imagine in the future, we're going to have entire medical schools and nursing schools, and not only will the didactic portion be online, but the actual skills-based implementation training will also have a huge component online. And then we come together, obviously, to do these in-person things, to connect, to network, to practice these skills, in person. But I think it's going to be a massive dominant force. But I think we're hearing it from two of the leading vendors in the space here that hybrid is here to stay. So if your institution has not yet considered the opportunities to kind of make some of these investment technologies, clearly the global community is saying, not only from the survey results that we're seeing, but from vendors themselves as they kind of interact with their community, that this is a really big, important part of the conversation moving forward. And so I think a lot of groups, it would behoove them, if they have not really made a serious kind of consideration of that, to start taking a look at those types of technologies and thinking about ways that they can't help. All right, so we've talked a lot about good things that have happened for the industry, even though bad things are happening globally with COVID. But I would love to hear about what maybe hasn't worked out. What did not transpire in terms of what your company saw with clients in terms of not necessarily this product or that product, but across the board, where were the major pain points that maybe we still need to work on or that could not really be solved yet within the short time frame that the world has been topsy-turvy? Have you seen things that maybe we can learn from or try to make improvements on from your perspective?
One of the biggest things is bandwidth. When everyone you're training, you're learning, you're educating in a virtual environment and everything is remote.
Right.
We do have still underlying infrastructure gaps. So a student who's in a rural environment is not going to have the same experience as a student in an urban environment.
Right.
And one of the things that some of us in industry have been working on is looking at how do we create some policy or create some awareness with some of at the national level to make sure that appropriate funding is carved out. We've seen in the past federal programs with funding carved out to bring more internet connectivity into rural environments, but it wasn't focused on education. And when you look at virtual reality tools, you look at a lot of the video-based live interactive learning where you're bringing that remote learner into an experiential rich multimedia environment, that does require bandwidth. So I think that's one thing that is frustrating and holds a lot of students back is access and equity of access.
Right.
And so that's something that I think industry and as the technology evolves, we'll get better at.
Yes.
But there's still some barriers on the technology side. We still have too many dependencies on unstable networks and things of that nature. So I think that's some things that need to improve to create a better education experience and make sure that's delivered the same way to every student, regardless of geography.
One of the survey respondents, because we had some questions about comments, in terms of like how has the performance improved and those kind of things. And one of them said that the differences in learner computer technology just at home that they had access to. So furthers your point with regards to bandwidth. Here now we have laptops that are out of date, because that was the best that the learner could afford.
That's right.
But that's not standardized because it's each learner has their own thing, and so I think that's that goes part and parcel with that conversation. Amar, what is CAE Healthcare seeing in terms of challenges maybe not yet met?
Adoption. I think one of the challenges that we certainly have across the market, and we're starting to see it, is people are still not really sure what is normal and what they should be investing in, right? And so if I make a large investment in a new technology or a product, is that really am I gonna need it a year from now or 2 years from now, right? So adoption of the technology is still there. We still have individuals that are technology scared, right? And so making an investment in an online ecosystem or an online platform when I may not be comfortable with a computer system today or documenting in an EHR electronically or whatever that challenge is, continues to be a huge impact.
Okay.
Culture is also a driving force behind that, right? We've lived in an in-person training environment for a long, long time.
And this is the way we've always done things.
And this is the way we've always done it, right? This is that normal as people want it back to.
Right.
And so there's a lot of that fear that certainly that's creating that ruckus in the marketplace right now.
Absolutely, very good. All right, well, I think that pretty much wraps it up for us in terms of the thoughts and opinions, in terms of the discussion that I wanted to have here today to kind of share more. I just want to leave it with both of you, though, to just kind of tell us, in summary, what do you think that this has done for the industry in terms of awareness, and what do you think is next? What do you think is coming from this in terms of where it's all going to take it? And then we can start with you.
Well, I think we're just going to continue to expand capabilities, and I agree with Amar. We're gonna see a hybrid. It's never going to be at all of an A or all of a B.
Right.
But it's going to provide more access to learning, which I think is critically important.
Absolutely.
We always focus in simulation on practice, train as you're going to practice, or in the military we say train like you fight.
Yep.
And train like you practice in more repetitions. And I think this explosion in the technology options has expanded the access to learning and the ability to have a student determine how often they're going to practice. We have never seen a simulation center that the utilization went down.
Right.
And many students we hear are concerned about having enough hands-on practice time. These hybrid formats give them more flexibility and options. I do agree with Amar, adoption. an
Awareness.
instructor having to master several new technologies can
Right.
be challenging.
Right.
But the students are growing up in those, they're native to those
Right.
environments. And I think we're going to continue to see that expand because that's how students expect and anticipate
Right.
they will learn.
I did a Google search. The first iPhone came out in 2007, which would make that someone born around that time about 16 years old. So we're going to see those people in clinical education facilities in 2 years. 2 to 4 years, they're going to be at some point in their professional healthcare degree program. And they are digital natives.
Yes.
They understand how to use these phones better than any of us. And their expectations be, what do you mean I can't turn on the simulator with my phone? Right?
That's
and so
right.
if we're not having this conversation now as the folks that are helping to lead these types of innovations and integrations, where will we be by the time those learners are in those spaces, right? And so I think that's a really important point with regards to adoption, the level of comfort that we have. I know that the Society for Simulation and Healthcare and HealthySimulation.com are both dedicated to trying to increase awareness and access to the materials necessary to be successful. But do we get there unless we have government kind of bodies that are helping to make sure that these things get regulated and mandated, just as they are in aviation simulation,
Yes.
right? We have an NTSA, we have an FAA, we have none of that in healthcare.
But I think you're starting to see that perfect storm pop up, right? So healthcare systems are realizing the impact and value of where simulation is from a quality and safety standpoint.
Agreed, totally.
We have totally seen that in the last 2 years of increased utilization of simulation, more insight to experiences, not necessarily to take away from the clinical practices that are happening in the real patient care environment.
Right.
But even, as we heard today on the plenary session with Dr. Frampus, there's a huge focus on making sure that we identify where the risks and the challenges are
Right.
in those systems and leveraging simulation
Where
to
are
be able
those
to push
pain
it.
points?
Where are those pain
Start
points?
there,
Yeah.
right.
What is the problem you are trying to solve?
Right, exactly. It doesn't, let's not just buy a thing and then see what happens. And that was actually one of the things that when I went to ITSEC this December, the Commandant of the Marines said, gone are the days when we will buy something and then ask the SimTech guy if it's going to work. We're not
No
doing
more.
that anymore, period. So I thought that was really
and you're seeing the
telling.
legislative elements behind that really
Right.
drive it, right? So we're now seeing bills being introduced that support, we just saw the Biden administration focus on maternal and women's care, right?
Right.
A huge area of focus. Well, you're also seeing bills underneath that supporting the education structure to drive effectiveness of
Right.
women's services,
Right.
And so I think that's going to continue to evolve as we go. It's an area and it's a perfect time in a storm to set the standards across healthcare simulation,
Right.
so that it is more safer for us at the end of the day, right?
And for everyone. And I think one of the important points I want to make is that these types of technologies and these types of opportunities, they're not just for the learners. And it's not just for patient outcomes, it's for the providers and the stress that they have in this profession, right? And to reduce those headaches for them as well as to improve, performance for better patient care overall. But, to be able to help those folks do their job better without as much finger pointing and more systemic level perspective, right? How can we look at these things in a new level? Well, I want to thank you both for joining me here today at the PRESSBOX at IMSH 2022. Folks, we got a lot more great content coming up next, so stay tuned for the next recorded sessions that we have coming up next. Thank you so much.